Senator Casey.
Thank you, Mr. Chairman. I want to thank you as chair, and I want to thank Ranking Member Cassidy, Senator Romney, and so many others who work collaboratively on the working group to reauthorize this legislation, the Pandemic All Hazards Preparedness Act. I also want to thank the staffs, both Senate staff, on my staff, Sarah Maskornik, who did such good work, and so many others, as well as the Legislative Counsel's Office for all of their work on this legislation. The last 3 years, I think, have demonstrated over and over again to us how essential it is to plan, prepare for, and respond to a public health emergency. This act is the underpinning of that state and federal response and has always been a very bipartisan endeavor. I'm pleased to once again be here to have a markup. This happens to be the fourth reauthorization of this law and the third that I've worked on in the Help Committee. I strongly believe we must prioritize a timely reauthorization of these programs and authorities before their expiration to prevent a lapse in crucial services that ensure both public health and national security. While every title of the bill is important, I want to highlight two areas I've prioritized in the reauthorization. Number one, addressing the needs of all groups of people, as well as strengthening biosecurity. The COVID-19 pandemic revealed the undue burden our most vulnerable populations experience during an unprecedented hazard like a pandemic. Without a strong voice in the planning of emergency response, children, seniors, and people with disabilities go unheard and their specific needs are unmet. This undue burden to their health and quality of life is, of course, unacceptable. For this reason, I've made it my priority in the reauthorization to establish technical assistance centers that can assist communities in planning for disasters for seniors and people with disabilities. And I've also included a provision that would ensure states consider these populations when planning for future hazards. Mr. Chairman, I ask consent for another minute and a half.
Without objection.
I've also included a section that addresses crisis standards of care that would require states to ensure any plans to distribute health resources and treatment during pandemics and emergencies do not discriminate against older adults and people with disabilities. An essential part of preparedness planning is the development of countermeasures, where our nation has already shown tremendous innovation. We must recognize that these pharmaceutical innovations also result in rare but concerning side effects for people. These Americans are using countermeasures like vaccines to benefit public health, and injury compensation programs are intended to provide them with the support they need after injury. Unfortunately, these programs are not functioning as they should, and Americans are suffering as a result. For this reason, I've proposed provisions that will improve the processing of injury claims. These Americans have waited too long for resolution, and we must respond to their individual needs. Finally, these remarkable innovations necessitate a research and development environment which values biosafety and biosecurity above all else. As we continue to learn about advances in biotechnology and their implications for the pathogens and agents that threaten the nation, we must evolve in how we manage those pathogens while still supporting research. As a result, I've codified the PAPARA authority for regional biocontainment laboratories. These labs across the country maintain constant readiness and surge capacity in the instance of a pandemic. Their work was pivotal in our response to COVID-19, and we should continue to provide them with the resources to be prepared for future threats. So, Mr. Chairman, I'm grateful for the work that everyone's done. We look forward to passing this bipartisan bill.